The key term in today's study session includes reactive attachment disorder. Reactive attachment disorder, also known as RAD, occurs when a child demonstrates significantly disturbed and developmentally inappropriate social relatedness that is associated with grossly pathological care. These disturbances are apparent before the age of 5 years in a child that has a developmental age of at least 9 months. Pathogenic care in the form of serious social neglect is the only known risk factor, as well as a diagnostic requirement for the reactive attachment disorder to be made. Pathogenic care during infancy includes a failure to provide for the child's basic emotional needs, for example, comfort, affection, and stimulation, or physical needs, including food, shelter, safety, or freedom from abuse. Such care is, by definition, extreme in neglectfulness. Pathogenic care may also occur when there are frequent changes in primary caregivers, such as through maladaptive foster care or institutional placement. These disturbances prevent the child from forming healthy selective attachments. This impairs a child's ability to establish appropriate interpersonal relations with adults or peers. Note, however, that the majority of severely neglected children do not develop this disorder. Symptoms of RAD are inhibition and emotional withdrawal from caregivers and persistent social and emotional disturbance. Emotional withdrawal is evidenced by the child's rarely or minimally seeking comfort from the caregiver when distressed, or minimal response to comfort when it's offered. There's also minimal social or emotional responsiveness to others, little positive affect, and periods of unexplained irritability, sadness, or fearfulness that may occur even during pleasant interactions with adult caregivers. Reactive attachment disorder may be associated with developmental delays, including cognitive and language delays, failure to thrive, stereotypies, and depressive symptoms. Medical conditions such as severe malnutrition may also be present. Parents of children with RAD often suffer from poverty, substance use problems, unmanageable personal stressors, and/or a history of childhood maltreatment and/or attachment difficulties themselves. Prognosis may be related to the quality of the caregiving environment following serious neglect. Aberrant social behaviors, limited expression of positive emotions, cognitive and language delays, and impairments in social reciprocity may resemble autism spectrum disorder, and a differential diagnosis must be made. Children with autism, however, rarely have a history of severe social neglect, and symptoms of autism include restricted interests or ritualized behaviors, which are not seen in RAD. Due to reduction in positive affect and what could be interpreted as social withdrawal, a child with RAD may appear to be having a depressive disorder. However, depressed children, usually exhibiting impairments in attachment, still seek and respond to comforting efforts by a caregiver. And despite also having developmental delays, RAD should not be confused with intellectual development disorder. Children with intellectual development disorder have social and emotional skills comparable to their cognitive skills, and generally are able to develop selective attachments and do not exhibit reduction in positive affect nor the emotional regulation difficulties shown by children with RAD. A DSM-5 disorder related to RAD that also results from severe social neglect is disinhibited social engagement disorder. But symptoms are of disinhibition, with children exhibiting little hesitation in approaching and interacting with unfamiliar adults, with a differing course of illness, prognosis, and a response to treatment. Let's practice with a question for reactive attachment disorder. The form of poor caregiving most likely to be associated with reactive attachment disorder is answer A, neglect, B, physical abuse, C, sexual abuse, or D, authoritative parenting. Answer A is correct, as neglectful parenting, in terms of both emotional or physical needs, is often associated with reactive attachment disorder, whereas there is no direct link with physical abuse or sexual abuse, although both of these are often associated with neglect. And as for answer D, authoritative parenting would actually have a protective effect against reactive attachment disorder.